Treating a patient with depression is very important. The management basically starts on when the patient walks into your outpatient department and he gives you a history of a typical depressive episode, and you're going to jot down the notes in your clinical pad, and after that you're going to assess the patient whether he's suffering from the milder form, the moderate form, or whether he's suffering from the severe depression. So it is very important over here to classify the patient, and you're going to treat that patient accordingly. So this is very important. Now, the social bonding is again very important when you are treating a case of depression. His friends and family has to be included in that treatment modality. That is the mainstay of treating depression or the psychiatric ailments. So in this section, basically, we're going to deal with the general principles when we are treating a patient with depression. And obviously, you're going to assess whether it is the mild, moderate, or the severe form of depression. And after that, you're going to diagnose if it's a recurrent depression. So this diagnosis is again very important over here. The general principles whenever we are talking about managing a case of depression, they're again very important. Obviously, the transient state of lowered mood, it can be a transient state of unhappiness, and you're going to diagnose this very important. Even the patient will give you a severe form. He may be having the suicidal thoughts, but still a practicing psychiatrist can diagnose whether it is a transient state, whether it needs a medical intervention or not. So the valuing in self-pity is again very important, and the illness models have to be studied in detail just to get an overview and assess what severity of disease we are dealing with. The active mastering of problems are again very important, and then a clinician or the working psychiatrist must be aware of the fallacy of the understandability. So he may be understandable enough to know the signs and symptoms of depression and assess the patient's suffering and the patient's state of self-pity. The mild depression basically gives you a psychological interventions, can basically treat such patients with mild depression, and usually counseling or the problem solving therapy. It can be just the counseling sessions, and it can basically vary from person to person. The number of counseling sessions will depend upon the severity of the transient unhappiness state. And then we can have the cognitive behavioral therapy, which is also known as CBT, and it's basically above the scope of this lecture, but you should know that there is a therapy which basically depends upon those counseling sessions, and that is known as the cognitive behavioral therapy, which gives you a change in your thinking process. So the self-help programs, or there are a lot of books on self-help programs, there are a lot of video lectures available on self-help programs in which the person basically helps himself, and his willpower is going to take that person out of that depressive episode. The 30 minutes of aerobic exercise is one of the treatment modalities over here, and antidepressants may be used as well. The moderate or to severe depression can be treated in a particular way. Antidepressants are the first line of choice whenever we are dealing with these moderate or severe depression. The selective serotonin reuptake inhibitors are the drug of choice. The cognitive behavioral therapy has to be inculcated in along with the SSRIs, and then there's going to be an interpersonal therapy. Willpower is going to be raised, exercises are going to be shown to that individual. So all of these are going to inculcate in that individual. Then there is going to be secondary care, that basically means the role of the friends and the family and the social support is again very, very important whenever we are dealing with a case of depression. To refer to the psychiatric services, if the treatment has failed, working as a medical practitioner and you're trying to treat that disease in your own way, but your treatment has failed according to the guidelines, then you're going to refer that person to the psychiatric services as well. Treatment options are unavailable in the primary care, and you think that the treatment options are not enough for that depressive episode. There's a significant risk of suicide. Life is at danger of that particular person, so you'll get help of that psychiatric services. Psychotic symptoms are present in that individual, and there is a bipolar affective disorder that is also suspected with these or with such mood disorders. Secondary care is again very important when we talk about such psychiatric disorders. There are various psychotherapies that are involved in such cases. For example, there can be medications as well. The serotonin reuptake inhibitors, they are again very important, or other antidepressants, they can also be looked for. ECT, which is also known, which is basically the electroconvulsive therapy that is given to such individuals with depressive episodes, for severely depressed patients, obviously, not with mild to moderate disease. The alternative antidepressants that can be used in such a case can be the venlafaxine, the serotonin and the noradrenaline reuptake inhibitors, and then we can have the escitalopram. It's one of the drug of choice as well, alternative to SSRIs. Then we have the mirtazapine, which is the novel antidepressant, and then we have the tricyclic antidepressants, which includes the clomipramine. Then we have the addition of lithium carbonate as an augmenting agent, or which is also a mood elevating drug. Monoamine oxidase inhibitors such as phenazine. All of these drugs can be associated if you're not going to take SSRIs, or SSRIs have their own side effects in certain individuals. Recurrent depression is another terminology that is used quite oftenly. It is usually marked by the recurrent illness, and the risk factors, it usually occurs approximately 1 in 2 in case of episodes over a long time. And why does it happen recurrently? Because the person has personality traits and is more prone to that depressive episodes. Prophylactic antidepressants are given for such people, and the cognitive behavioral therapy, also known as CBT, is given for such individuals. So in this section, basically, we dealt with the fact that when a person presents to you in the OPD as a depressive episode, you're going to first of all assess that person whether he is a case of mild depression, moderate depression, or severe depression, and then you're going to start on with the treatment therapies. Obviously, if it is a case of mild depression, you're going to stick on to that CBT, which is also known as the cognitive behavioral therapy. When we move on to the moderate type of depression, it's basically treated with the CBT. Along with it, some medications will be given, such as the SSRIs or the serotonin reuptake inhibitors. And in severe form of depressions, CBTs along with medications and along with the help from the social circle, it is coupled up with the electroconvulsive therapy, which is the last choice in a lot of cases. So that is the end of this section. Thank you for watching sqadia.com.